Hi everyone, my name is Madison, and I'm going to be talking about lymphoma. Before I start talking about lymphoma, I first need to talk about what the lymphatic system is. The lymphatic system is a network of structures that drain extra fluid from your tissues and return it to your bloodstream. These structures include the lymph nodes, the lymphatic vessels, and the structures that contain lymphoid tissue. Your lymphatic system has several functions in the body. This includes keeping your fluid level stable, transporting lymph, which is a clear, thin fluid that contains white blood cells, and transporting proteins and fats. Your lymphatic system is also part of the immune system. And in this image, you can see the lymph nodes and the lymphatic vessels. So what is lymphoma? Lymphoma is a cancer that begins in the lymphocytes of the lymphatic system. Lymphocytes are the cells of the lymphatic system. Although there are many types of lymphoma, the two main types are Hodgkin's lymphoma and non-Hodgkin's lymphoma. In Hodgkin's lymphoma, a Reed-Sternberg cell is present, and you can see the Reed-Sternberg cell right here. The cause is unknown of Hodgkin's lymphoma, but it is more curable than non-Hodgkin's lymphoma. In non-Hodgkin's lymphoma, there is no Reed-Sternberg cell present. The cause is also unknown, but it is more common than Hodgkin's lymphoma. Lymphoma usually begins in the lymph nodes, but can spread into the lymphoid tissue of other structures, like the spleen, the Peyer's patches of the small intestine, and the tonsils of the throat. Lymphoma begins when a lymphocyte develops a genetic mutation. These genetic mutations tell cells to begin multiplying rapidly. More and more large abnormal lymphocytes are made, and then they pile up in the lymphatic system and push out the healthy cells. Some signs and symptoms of lymphoma are painless swelling of the lymph nodes in the neck, armpits, or groin, fatigue, fever, night sweats and chills, unexplained weight loss, and difficulty moving body parts. And in this image, you can see the difference between a normal lymph node and a swollen lymph node. Like in other cancers, lymphoma also has stages. In stage 1 of lymphoma, cancer has been only found in one organ or lymph node. In stage 2, the cancer has been found only on one side of the diaphragm, but in 2 or more lymph nodes. In stage 3, cancer has been found on all sides of the diaphragm, but still in the lymphatic system. But in stage 4, the cancer has spread to organs or tissues outside of the lymphatic system. Lymphoma can affect the body in many ways. When it affects bone marrow, it may prevent you from making new blood cells. If you are unable to make white blood cells, that puts you at an increased risk of infection. If you are unable to make red blood cells, that leads to a lack of oxygen. If you are unable to make platelets, which help to clot your blood, that can lead to excessive bleeding, which puts you at a higher risk for developing a brain bleed, which could lead to a stroke. If the lymphoma affects your lungs, that may cause a difficulty in breathing and puts you at a higher risk of chest infections. If the lymphoma affects your liver, that prevents the liver from performing necessary functions like removing toxins, producing bile, which aids in digestion, or regulating blood sugar. The lymphoma can also affect the viscosity or thickness of your blood. The lymphoma cells produce abnormal proteins that thicken your blood. The thicker the blood, the harder it is to get through your blood vessels, which decrease the blood supply to your brain and organs. Here are my image citations, and here are my information citations. Thank you.